Hi, I am Dr. Carlos Simón, CSO of Igenomix. I'm going to explain you briefly about our endometrial receptivity analysis, ERA. Many IVF cycles result in implantation failure even after transferring chromosomally normal embryos of good morphological quality. Apart from the embryo, another key factor for reproductive success is the state of the endometrial receptivity at the time of embryo transfer. The endometrium is non-receptive for most of the menstrual cycle. By investigating the gene expression or transcriptomic profile of the endometrium, we can diagnose the endometrial receptivity status as a critical parameter of women's reproductive health. After more than 10 years of research, in 2009, we created a test designed, developed, and patented by Igenomix named as Endometrial Receptivity Analysis, ERA. ERA is a molecular diagnostic test using next-generation sequencing to analyze the expression of 236 genes involved in endometrial receptivity. The results provide a personalized genetic profile which indicates where is the personalized window of implantation of a given patient. The aim of this test is to identify a possible displacement of the window of implantation, enable to the doctor to perform a personalized embryo transfer for his or her patient, and thus increasing the chances of pregnancy. The ERA test requires a standard endometrial biopsy that should be carried out under the same conditions which the embryo transfer should be or could be performed. If the result is non-receptive, then the window of implantation has been displaced, and the ERA will be able to let us know when is the right window of your patient, using a single endometrial biopsy in 90% of cases. The consistency between the diagnosis and transfer is very important. The ERA test can be performed either in a natural cycle, considering that the timing should be at LH plus 7, or in a hormonal replacement therapy cycle, and then should be done after 5 days or 120 hours of progesterone administration. Depends on the planning of the doctor. ERA is not suitable in fresh embryo transfer cycles due that the hormonal levels are very high and inconsistent, so we cannot really extrapolate to the next cycle. The process to obtain the ERA test is very simple. It requires a fragmentation of the cycle. The first month will be devoted to obtain the oocyte, create the embryo, and freeze the embryo, whether it's chromosomically analyzed or not. And then in the second cycle with the menstruation, the HRT can be prepared as follows. Just between 7 and 10 days of estradiol administration after the menstruation, then an ultrasound is performed to evaluate endometrial thickness and pattern, and if everything is okay, we will check progesterone at this moment to assure that the patient has not ovulated yet. Then progesterone, either intramuscular, vaginal, or any other route, should be administered for the time indicated, 5 days or 120 hours, obtaining the sample in due time. Now, then the patient should be deprived. In 3 days will menstruate. Again, we will start with 7 to 10 days of estrogen, and at that moment, which means 10 days after menstruation, the ERA inform is ready, and then the personalized embryo transfer can be planned by your doctor. Total time from the menstruation to the personalized embryo transfer is about 1 month. The ERA test is indicated for patients with recurrent implantation failure, as demonstrated by a number of publications from different groups, and the randomized clinical trial on the first appointment will offer information on its medical value in all patients undergoing IVF. To complete overview of the endometrial factor, the ERA test can be complemented by the investigation of the endometrial microbiome, a test named EMMA, and also by the microorganisms causing chronic endometritis, and the name of the test is ALICE, using the very same endometrial sample that has been obtained for the ERA test. If you have any questions or need more information, please do not hesitate to contact us. Thank you for your confidence.